Hey, welcome to the Elle Russ Show. My name is Elle Russ, and I am a #1 best-selling author and master coach. My intention is to inspire, educate, and motivate you with weekly content featuring amazing guests and solo episodes. Visit my website, elleruss.com, to learn more about me, my courses, free masterclasses, partner discounts, and much more. Enjoy the show. Dr. Corey Reiser, welcome to my new show. We've spoken before. How are you?
I'm doing fantastic, Elle. Thanks for having me. I was going to say back on, but on the new show. It's good to be here.
Yeah. So listen, you're a functional medicine practitioner, Functional Health Center of the Carolinas in Charlotte, North Carolina. And I love what you're doing over there because functional medicine is the whole picture. But why don't you just go ahead and describe to us the type of work you are doing? It is a regenerative medicine clinic group. Tell us about regenerative medicine and functional medicine and give us a little bit of a rundown.
Sure. Yeah. So if you've listened to the previous podcast that I did with Elle, obviously we do functional medicine at my practice at Functional Health Center of the Carolinas. Since then, I've begun working with a clinic group that started out in South Carolina called QC Kinetix. It's non-surgical regeneration, so regenerative medicine. They've been around since 2017, started with one small clinic in Charleston, South Carolina. And since then, we've grown to about, 178 clinics nationwide right now, and soon to be, I think, about 500 all said and done. But QC is very similar to the functional medicine world, where we were founded on the premise that we want to enhance the quality of life for as many people as possible without drugs and surgery. So it aligns with various different forms of alternative medicine, and regenerative medicine specifically is going to speak to people with musculoskeletal injuries, hair restoration, hormone issues, things like that. And again, similar to functional medicine, we're trying to, enhance the quality of life people or change the trajectory of people's health without drugs and surgery, and using more natural methods. With regenerative medicine, in this case, it would be biologics from somebody's own body, which is something that's not necessarily new. It's been around for quite a long time, probably over 100 years. But you know how it goes when things don't involve a drug, medication, or something like that. It doesn't get as much of the press. But luckily, probably in the last 10 years or so, it's really increased in prevalence across the United States, especially. We were a little bit behind on it. But thanks to, clinic groups like QC Kinetix, our goal is to get a clinic into every single city in the United States so patients can have access to this.
So tell us, what are the most common conditions that you guys are coming across? People are walking in your door. What's the general sense?
Mm-hmm. Yeah. So I think this will help us better understand even what regenerative medicine is. So initially, when QC Kinetix was opened up in Charleston with that one clinic, we had we focused on people that, the most common condition I say the people were involved in would be arthritis, osteoarthritis of the knees, of the hip, of the lower back, elbows and shoulders, all kinds of joint issues, musculoskeletal problems, partial tears of tendons and ligaments. That's the focus. Because up till that point, especially in the United States, the things that people were receiving as far as treatments for those conditions really were just Band-Aids, and really still are in the conventional sense, in the conventional medicine sense. There really is no root cause approach. So the average patient that's walking through a QC Kinetix is going to be somebody with that osteoarthritic knee, osteoarthritic shoulder, or rotator cuff tear. Those are the conditions that we're primarily after, because I think there's just such a big gap in conventional orthopedic treatment of these conditions.
It's what would you say, like, if people are out there and they're like, well, I don't want any of these problems. I don't want to have this happen to me. Yeah. What are some tips on maybe prevention with these types of situations?
Sure. Yeah. And I think especially with the United States, I mean, you've got let's just take knee osteoarthritis, for example. You've got currently, I think, 32.5 million people, 32.5 million people in the population of the United States that have knee osteoarthritis. And if we're looking, just 7 years down the road here, Elle, in 2030, we're projected to have 67 million people burdened with osteoarthritis, which it's crazy. It's something where, if you really look at the disease and the disorder itself, the most common issues are going to be BMI, weight, and then just overall health of the individual. So, if we're talking about how do we prevent this stuff from happening, certainly being healthier, limiting inflammation, getting your BMI to an appropriate level, and preventing that excess wear and tear on the joint. And then, that's where QC comes in as well, where, a lot of people, especially in the United States, not the best at prevention, obviously not the best at being proactive with their health, but also, realize that maybe later on or too late, or maybe they have a career where maybe there is excess wear and tear on those joints that they just can't quite get around. Maybe they are a mechanic, maybe they're a carpenter, maybe they're a weekend warrior that still loves to do that marathon every month into their 40s, 50s, and 60s. And those joints just don't quite regenerate and heal like they used to. So, we always want to look at that from a natural perspective. And that's where we come in, where we say, well, gosh, the body is so good at healing itself. Let's, in a functional medicine sense, if we just simply, eat paleo, or we address hormone issues and thyroid issues, the body can achieve homeostasis again. But what about the joints? The body is going to send growth factors and healing properties to those joints when you're younger, when you're 20s and your 30s, and it heals. But once you get up into age 40s, 50s, and 60s, and hormones play a role in this, but certainly wear and tear, that trajectory of how quickly that joint heals goes down. So what we want to do is concentrate all of those things that are in your body that heal, and that's what they're best at. And we concentrate those things, and we just administer them into those joints so that they can do what they do best, which is regenerate some of that tissue, heal that tissue, and get people back to a better quality of life. Or continuing to do that marathon that they so love every single month as they age.
Oh, hey there. Sorry, I was talking and I pressed the mute button. I was going to ask you, can you detail a little bit more about the treatments? If we come in for this, like, run us through, like, what happens? We've got a bad knee, we've got a bad shoulder. We want to keep doing the things we love to do. What happens?
Sure. Yeah. So, what we want to understand first is, is this rooted in science? Yes, absolutely it is. And honestly, when we talk to our patients, it's easy for them to understand how I always describe it to patients as far as regenerative medicine is concerned. Have you ever cut your hand? And everybody's going to say, yeah, absolutely. I've cut my skin. And that's kind of where the intrigue stops as far as the body is concerned. But if you really think about it, how amazing, how miraculous is it that your body is able to seal that cut up, scab it over, and it replaces that cut with new skin? And that's kind of what regenerative medicine does, is we're harnessing those, or that body, your body's ability to do that, and just administering into a joint. So what we're trying to do is improve cartilage quality and decrease poor cartilage areas within a joint by using certain biologics from the body. So the most common ones and people that are listening to this have probably heard of, platelet-rich plasma would be one, or a PRP injection. So
yeah, can you explain that? It's a really interesting, but it has really helped my cousin in his shoulder. He's done a couple of them, and I was fascinated by this when I heard about it many years ago.
Yeah, absolutely. I think some people even call it, if you've ever heard of it, liquid gold. So it's a simple blood draw. Any of our patients will come in, and it's going to be what we call kind of the bookends to our treatments. They'll start out with a platelet-rich plasma, depending on their condition. But for the majority of cases, arthritic conditions, you'll have a simple blood draw, and then we'll spin that blood down in our lab within our clinic. And we're just simply separating out growth factors and healing properties in the form of platelet-rich plasma. And when we administer that concentrated liquid, that liquid gold back into the joint, that PRP is going to go in there and start to stimulate healing and regeneration of those damaged tissues, whether that's damaged cartilage or a tendon or a ligament. That's what we're after with PRP. And many people kind of their first experience with this maybe be with a rotator cuff injury. And if you know anything about rotator cuff tears or even tendon tears, I think it's about 80% of them, given the right environment, will heal. And so that tells us you don't necessarily always have to go a surgery route just because you have a partial tear. So what we're trying to do with a PRP or multiple series of PRP is to provide that right environment for your tissue to heal. Because when you first get injured, that's what goes to that area is plasma and platelet-rich plasma to basically take those growth factors and those healing properties to that area so that you can heal. So all we're doing is just basically saying, well, why don't we just concentrate a bunch of those and put it right in that area? So now there is that environment for that tissue to heal.
I mean, that surgery is so brutal. The rotator cuff surgery, right? Right. I mean, maybe they got it, I don't know, a long time ago. It's a long one and it's brutal. So yeah, there's other options before you go straight to surgery. I know people are just looking for an instant thing, but that's a pretty big step to take when there's other options.
Sure. Yeah. And I think that's the problem right now is, out of the 32.5 million people with knee osteoarthritis, let's just take them for example, 10% of them will seek out a cortisone injection. And that's kind of your standard treatment for any kind of osteoarthritic condition, whether it's knee, hip, low back, shoulder, or even your rotator cuff tears. I mean, and we've all been there. I think if you're a patient listening to this and you've had these injuries, the first thing that's going to happen is either a pain medication or they will administer this cortisone injection. The problem being, and there are several studies that support this, is that cortisone injection is going to basically progress the damage that's already there. There was a multi-center longitudinal and observational study of nearly, I think it was like 5,000 people. They tracked these people over 14 years that had knee osteoarthritis. And after 2 years of having cortisone injections, as compared to the control group that didn't have any kind of treatment on their knees, that group that had the cortisone had far worse arthritis in their knees. So the treatment that we are almost kind of saying is, this is going to help with the pain and help with your arthritis, actually is making it worse for these individuals.
Well, let me ask you this. I just want to play devil's advocate here. I wonder what that's about. Is that because the cortisone does such a good job that it makes them then overuse the thing where they may not have, had they not had this mask of the cortisone shot?
Yeah, I think.
Or is it technically the cortisone? Because here's the thing. I've had a tendonitis and tenosynovitis in my arms and hands for like 20 years. Every once in a while, and they last very long time for me, actually, like sometimes a couple of years, I will get one cortisone shot into my wrist. It hurts like a bitch. It's horrible. Like not just the actual shot, like the week after is a nightmare. It hurts before it gets better. But then I will say that I notice an incredible improvement. Now it's not an arthritic thing, right? It's another kind of itis, right? But I wonder too, though, if people are then over, so what is it about the cortisone shot that makes it worse? Is it technically the cortisone in that study, or do they not know? Or is it because of what I just mentioned, possible overuse due to the masking of the pain?
I think it's both, honestly. So I do think, when you have your cortisone injection, they're going to put a little bit of lidocaine in there as well. So you now have this numbing effect and you go, holy smokes, my wrist or my knee feels amazing. Now I can go back out and walk. And now you're doing damage to that tissue or that joint for sure. But also if we look at cortisone and how acidic it actually is and what it does, what the mechanism of action of cortisone on its own is, you're making those tissues weaker, you're eroding bone and cartilage with cortisone. And I think that's why you see the re-injury occur with a cortisone injection, because all those tissues are now weaker and then the overuse occurs. So I think it's a combination of both. And I think that's I think that's the worst part about it is you've weakened this joint, and now the person that has the joint is using it more than they should. And now you have two very bad things happening at one time. And that's why they always recommend to you, don't do these close together, and you can only do so many cortisone injections, and you can only do them so frequent. So, I think you see in these studies that it accelerates the time between somebody being diagnosed with arthritis to their time in a surgical suite getting that replacement.
I'm not saying people should quit their favorite things, but I will say that there is also a moment too, over the course of my life, whether it's myself or friends, you kind of get, you got to get kicked out of one of your sports or your things based on something happening, and I'm really happy one of my friends who was an avid tennis player started to notice things going on wrong. And instead of push through, was like, you know what? Maybe this sport's not the best thing for my body, and she probably saved her back and knees and all sorts of things by just going, what, I love it so much, it pains me, but I'm going to fade out. So I think a lot of people too sometimes push through, right? Like I love tennis. If I could have a dream come true, I would have been a Wimbledon champion. That's like my sports dream. And, getting tendonitis in both of my arms limit that. That doesn't mean I can't go play tennis every now and then. I do play ping pong, play a game of tennis. I just can't play 3 days a week on a league. And I would be really killing myself. I'd have to get lots of cortisone shots or, what I'd be, doing that. I know a lot of people are doing that. Sometimes you're like, stop running. Guys, if you've got bad knees, maybe there's something else, an alternative. So I just want to throw that out there. Sometimes you got to gauge this and see, maybe you need to dial things back.
Oh yeah. Well, that's the athlete's curse, right? What are we always told when we first start sports is pain, and no pain, no gain. So you push through, right? And we have to start listening to our bodies. I feel like every time you're on a podcast, I think somebody has some sort of story that involves that. You got to listen to your body. And there's going to come a point in time where, whether it's biomechanically how you run or the sport that you do or the repetitive use of that elbow, there's going to come a point in time where you just do not heal as well as you used to. And so, I think that's why the weekend warriors are a lot of our patients, because they recognize that and they go, I am at a crossroads here. Do I give up the sport, or is there a way I can do this sport without doing, a detriment to my elbow or my shoulder or something like that? And that's why you see athletes primarily, do these type of treatments that we do at QC Kinetix, because they're natural. They can keep you on the field. They don't cause the condition to get worse. There are no side effects. You look at all those athletes that they used to fly over to Europe to get these regenerative medicine treatments done because the U.S. was so, and I hate to say it, but we're just so pushed by the pharmaceutical industry. Of course. They had to fly over to Germany to get PRP and all these things. And then they would come back and everybody was so blown away about, wow, they had, 3-4 more years in their career because of these natural treatments. So yeah, I think that's the athlete's curse, is that you're not going to perform like you did when you're 20 if you're 50, but you still have the internal drive. So how can we keep you on the field or on the track or on the tennis court with almost as close performance, but with no side effects and or anything like that?
Now, I also and I know you're on board with this notion of, hey, if you are having some of these issues, you got to look at diet. We got to look at grains. We got to look at some of the inflammatory things that are contributing. I mean, I've known people who've quit grains and then they had grains and then the next day woke up and could barely walk, right? Because of whatever it did to them. And that's not necessarily even an autoimmune thing versus the general aches and pains of whatever was going on in their body. It just makes it worse. So can you talk to us a little bit about some of the nutritional moves one can make or what people should avoid if you are dealing with something like this and how to look at that?
Yeah, and I think you're right. You have to separate out your autoimmune people from people that aren't experiencing some sort of autoimmune disease. So let's just take your typical person without an autoimmune disease. I think your two biggest food items that you can, well, let's just say three biggest food items that you just pull out and in general to support anti-inflammatory effects in the body is going to be your grain products for sure. Dairy to an extent, and I'd say dairy for me, if I were to have myself with 10 different patients in a room, dairy doesn't do too much to me. I don't feel like it's as inflammatory to me as it's somebody else. But then, this is what we're talking about. Listen to your body. There's certainly patients where I pulled them off dairy, and it was like, holy cow, my knees are fantastic. They feel so much better. And then of course, sugar, if we're just keep pumping your body full of sugar, I mean, that's the easiest one. I had a conversation with a patient last week, and it was all about his fibromyalgia pain and shoulder pain. And amazing diet, fantastic diet. She's eating great. She's losing weight, but we still have this pain. And I'm investigating and probing and all this stuff. And lo and behold, I'm like, what are you doing every night after dinner? Well, I have 3 glasses of wine. And I said, okay. And I said, well, she goes, but I'm sugar free. And I said, well, what do you think alcohol is? It's a sugar. And, that quick change, even from that last week to this week, just ditching that is, wow, what a decrease in my pain, and people sometimes don't think that the easiest things can make as significant impact or make a significant impact, like just simply removing the grains and the sugar and dairy, if you feel like that's something that is going to affect you. So, and I know for me, as soon as I ditch grains, I just feel lighter. My joints move better. They just feel more lubricated, So I think
I'm with you on this. And I'll say too, I don't have a known gluten intolerance. I don't have Hashimoto's. I have regular hypothyroidism, but if I went on a grain train for even just a few days, like, oh, hey, this is fun. I'll feel it. I'll start to feel it. I feel it in my brain. I feel it in my body. I feel it. And I don't have the things that would make it right. So I can only imagine how detrimental it is to someone who's really technically affected. Although I would say, I think you and I would both say rye, wheat, barley, bad for humans, and grains in general, but just eliminating that and dairy is such a game changer. Oh
yeah, absolutely. And that's what I'll tell patients, it's not like this isn't forever, right? But we have to find some sort of balance where you're not experiencing the symptoms that you want to get rid of. And get to that point where you can indulge if you want to, right? Because we always want to have that mental health a little bit if you like your bread, but there's got to be a point where you understand that the cause and effect. And I think for a lot of people, those grain products and sugar, you can certainly see them as a cause for a lot of that, or at least an amplification of that joint pain, because there is that damage that's already there, and you're just making it so much worse by inflaming it.
Yeah, it's if you're out there and you haven't tried. Also, I just want to plug too. I don't have an association with them other than I love this company. I'm not a drinker, but if you are a wine drinker, look into Dry Farms wines. They have the lowest sugar, no sulfite crap wine out there, and people have said who are wine drinkers that they don't feel the hangover and the effects because it has such low sugar compared to other bottles of wine. So if you are a drinker and you're hearing this and you're like, damn it, I still want my wine. Okay, well, if you can't eliminate it, then maybe make better choices there. Right. Also, I want to point out a book called No Grain, No Pain. And one of the things in there that he talks about is, you might eat gluten and it could take maybe 10, 11 days to get out of your intestines or whatever, but the inflammatory response can last up to 2 to 3 months. So if you're really trying to get ahead of it, like you said, it's not a death sentence to never have grains again. But I always ask everyone, how quickly do you want to get better? How badly do you want to get better? So it's a temporary sacrifice to get to that point. And then when you are better and well, and you've been there for a while, go have a piece of New York pizza and see what happens. You know what I mean? But it's funny how people look at this thing like, oh, no, forever, I'll never be able to. And you're like, no, it's just about a temporary thing and maybe forever. But how quickly do you want to get better? And I think you have to consider that.
Yeah, I think so too. And that's a conversation that I've heard recently as well, especially in the functional medicine realm or just alternative medicine, regenerative medicine. There's this... there's no middle ground. A lot of these providers, they'll onboard a patient and that's it. It's there, no grains forever, no dairy forever, no sugar forever. And you have these patients that maybe don't get better, but now you almost retrain their brain to think that they're never going to get better unless they avoid all these foods at all costs. And then they get on this journey of eliminate. And you can't do that. You cannot do that. And, that's a big frustration for me, especially with functional medicine, is that, I don't know how it happened. But you'll get patients that come in and they've been on an elimination diet for 2 years and you're going, okay, is this still therapeutic for you? Or are you just so scared to go back on foods. And now we all of a sudden have an emotional and psychological problem to deal with,
Right.
rather than a physical problem.
Absolutely. You work, your outfit in North Carolina works with people remotely. Tell us how we can benefit from you personally, because we don't have to live there to get help from you and your group. Can you tell us how you guys work with other people who are not in your location?
Yeah, absolutely. So I think post 2020, this was something that was a mission for us to cast a wider net. And so our telehealth services have certainly expanded since then. And within our office, we have direct primary care. We also have functional medicine. Both of those services, you can do telehealth. Obviously, our website's fhccarolinas.com. That's the first place to go to request an appointment. And then you can work with us. I mean, whether you're in California or you're in Canada, South America, doesn't matter. We will consult you virtually. Same thing with QC Kinetix. I think that's the goal for us as far as the regenerative medicine aspect. And my involvement with it is to make sure that we have got a location in almost every single state in the United States so that you can have access to that as well. QCkinetix.com is where you would go to find your closest clinic location in case you do have any of those, any knee pain, shoulder pain, back pain. You can certainly find a location, hopefully, no matter what state you're in, as close as possible to where you live. And both cases, you come in for your initial consultation. We figure out what it is going to require for you to get better, and then customize a plan to you, which is, and me, the first time we spoke, that's a big thing for me, is to treat the patient, not the labs, treat the patient, not the imaging. That's what it's got to be. So in both cases, that's how you'd get a hold of me and work with us.
What are you excited about right now in the field of regenerative or just functional medicine, like things you've seen, like hopeful studies, or you're like, ooh, this looks interesting for that? Is anything coming up lately that you're excited about in the future, of whether it's anti-aging or any kind of other health, and anything that sort of excites you?
Yeah. So we'll say specifically with QC Kinetix, the stem cell therapy piece to this is huge. I'm hoping that the U.S. kind of catches up with the rest of the world, because we've seen, especially with bone marrow derived stem cell therapy for joints, we see that improvement in cartilage quality and that decrease in poor cartilage in these joints. We've also expanded too into hormone therapy, so testosterone replacement therapy for individuals, hair restoration, just trying to almost cast a wide net with all these natural remedies for people so that they don't have these side effects or anything. And that's kind of the mission for QC right now, is to utilize these regenerative medicine therapies to get people back to where they want to be, whether that's through hormones or whether that's with their hair, doing, platelet rich plasma to their scalp so they can regrow their hair. And then certainly the joints. I think right now, I believe there's a study that was just initiated, I think in November, out in California, with stem cell therapy and joint cartilage. So I think you're starting to see, and certainly Tony Robbins came out with his book, Life Force, talking all about anti-aging and regenerative medicine. And I think you're starting to see the tide turn. And I know some orthos that are starting to do PRP and things like that. So that in the field of regenerative medicine, I'm just excited that we're finally taking a look at something that's just not stuck in the drug model and just a Band-Aid for these individuals and for these patients. And certainly the patients that we've seen, just even from the inception in 2017, we have patients that are still pain-free from their initial treatment in 2017. They're going on their 6th year, 7th year of pain-free knees and avoiding that knee replacement. And I think if we look at this in a different way, how nice is that going to be for the United States or the American healthcare system when we can avoid a total knee replacement that costs, the average American anywhere from $30,000 to $70,000? How nice is that going to be when your person that's living paycheck to paycheck doesn't have to miss 12 weeks of work to rehab and to get that knee or that shoulder right. They can't support their family because of that. So that's our mission. And I think, being open since 2017 now, and my involvement for the last 3 to 4 years, seeing patients or getting text from patients that are saying, I was disabled for 4 or 5 years and I finally have a job again because I'm not in pain. That's the stuff that is exciting for me coming down the pipeline, where we're really overhauling the American healthcare system when it comes to orthopedic treatment of musculoskeletal diseases and disorders. And I'm anxious to see, these studies continue to come out about stem cell therapy and PRP and what it can really do and how it can keep people off opioids and pain medications. And, I think that's the number one thing I'm excited about.
You talked about working with some hormones and you mentioned testosterone. Mm-hmm. So I just want to give a shout out to all the ladies that are listening. If you are in your 40s or older, you might really want to consider testosterone replacement.
Crazy. I don't think people put 2 and 2 together, right? And
you really do. So I take testosterone because of my age and it's warranted. I can tell you the difference between having it and not. So one of the differences is like literally the difference between the ability to build lean muscle mass and endurance with exercise and weightlifting. Unbelievable 180 difference from before. The other is, again, what makes us strong-headed human beings, and I was weeping at, like cat food commercials. I was like, in my car, I went through like boxes of Kleenex because I would be getting like so nostalgic, sentimental. Like I wasn't even crying because I was depressed. It wasn't like sad stuff. I'd be crying about like what a wonderful mother I had, or like what I just was like, why am my eyes were, I was like red. I was like, what is going on? It was perimenopause, right? And so I am a big fan of bioidentical hormone replacement for this time. When I look at women who haven't done it, number one, they have no sex drive and they're all dried up. The aging is extensive. And also just the level of motivation. I notice women who are my age who aren't doing it, they've kind of given up, Corey. Like they're, you hear them kind of be like, I don't know. I don't just have any motivation anymore to give a shit. And you're like, really? Because they just don't have that level of testosterone to give them that drive that you guys have in crazy amounts, but we also need too. So maybe just in your experience, can you touch on some maybe 180 stories of people who've done testosterone replacement, things you've heard, some positives like I'm talking about, and in general, the importance of it for anti-aging?
Yeah, actually, I mean, and this is, I'm going to the extreme right off the bat, but I think it's important, to get to this story because we literally were just talking about this patient last night. It was an individual who she said that, I guess from years, I suppose of the lack of motivation, when she arrived, it was to the point where there were considerations of her taking her own life, and conversations like that. And, her return and after treatment and, all the things that happened to her to get her back on track. That was the conversation she had with us where she said, look, I was at that point and simply getting things balanced turned me into a new person mentally. And here I thought that it was just the life I had lived and the things that I was dealing with externally. That's and right. It was all internal and it was just getting things balanced. So, I mean, that's the most extreme story I can think about just because that was one of the most recent ones that we are actually talking.
But that's a good one because that general malaise can deepen into what you're talking about with how she felt. Yes. Absolutely.
So, and then, not as extreme, but everybody that comes in and whether it's a male or a female, it's let's just talk about the females first. It's estrogen and progesterone. That's what they are always spoken about with their providers. And I'm almost tired of it because that's, like you said, it's not.
They're always missing the third thing, right?
Missing the third thing. And it's as easy as just going, well, let's just push the T a little bit, see what happens. And lo and behold, all of those symptoms start to go away and they start to feel better and they start to look better and they have the energy back. And again, it's one of those things where it's like, I don't know where we went down the wrong path. I assume with, in the 90s with oral contraceptives and everything else, it was Oh, you're on your period, estrogen. Oh, you have acne, estrogen. And, you're going through menopause, estrogen and progesterone. Like,
well, that's what they do with me. Like, oh, you're bleeding abnormally as a 30-year-old. Oh, well, we'll just put you on like birth control pill and patch that up versus ask the question why you are a healthy 30-year-old bleeding. And maybe they should have checked my thyroid. So a lot of people, well, I guess we'll just plug that here, right? So if you have a hormonal imbalance, before going directly to hormone replacement, check your thyroid, because that could be the cause of the hormonal imbalance. But if it's not the thyroid and you're of a certain age, or it's warranted, it is, I don't know that I would live without it. I had a friend who went on a vacation for 2 weeks. She forgot her testosterone and she was like, that sucked.
I'm sure. Absolutely. Yeah. I mean, gosh.
Well, it's so lame. And I just want to share that this is how misogynistic medicine is. Any guy can go to any CVS or any drugstore, Walgreens in the United States, and get their testosterone. But I can't. I have to go to a compounding pharmacy.
Yeah. Oh, I know.
Because it's just, yeah. So you still have to go to a compounding pharmacy. The other thing too, and everyone can reach out to me or Google Dr. Forsman perimenopause. I did a whole menopause thing with him. And this is the other problem. This is why I appreciate you as a doctor as well, treating for the person, not necessarily labs, because there are people that, like we can only test the keys, not the locks, right? So there are people that may come up with testosterone on the higher end of the range, but they still need it. Mm-hmm. There are people that have low testosterone and have a high sex drive. Sometimes these things aren't equally correlated with how we think, right? So that is why it is important, right? To not just go by blood levels on these kind of things.
Yeah. I mean, and to your point, I remember a patient we had, gosh, it was probably 3 years ago, young guy, I think 26, 27. And they were just pumping him full of testosterone to try to figure out, he had no motivation, as far as muscle mass, it was lacking, no energy, couldn't sleep, all these things. And of course, he comes back a little bit low on his T, and they pump him full of it for a year and a half, and he just is not getting anywhere, no change, and they just keep going. And he gets to us, and the guy is, he's developing almost breast tissue at this point. And he was just over aromatizing into estrogen, and they never thought to look at that. They just kept running T and free T on him. And so sure enough for us, it was like, look, we're going to keep you at a certain level of testosterone, but we need to start looking at all these other things. What's your liver doing? What's your gut doing? All this stuff, cleaned it up, and that was it. Now the T can actually do what it needs to do for him. And he had to stay above a certain level. He was above the lab range on his testosterone, but that's the other thing I always want to point out with that is, again, some places and some clinicians, they just get caught up on this service or this specialty, and they ignore the patient. And he's telling, that patient was trying to tell them, I'm still not sleeping. I still don't have energy. I'm gaining fat in places that I shouldn't. What is happening? And so you've got to take it from a holistic, whole body approach, right? So that was another interesting patient to me, and just simply getting him detoxing and having regular bowel movements. Gosh, what a weird thing to work on.
Everybody should be pooping once or twice, maybe even 3 times a day, depending, but at least once, everybody.
Yeah, absolutely. So, but that was another interesting one for sure, especially about hormones and treating the patient.
Yeah, treating the patient. Same thing happens with thyroid, as you know. Someone might need to be at a certain level for them, that's right for them with their free T3, and then a doctor will freak out because to them it looks like it's hyper, but then they're not evaluating, do they have hyper symptoms? Like you can check those, like their temps and vitals, like to determine this, you know what I mean? And, I have a success story from my book and in general, who has to be on free T3 level. Let's say it's 2.0 to 4.0, but she has to be around 3.9. She has to be up there in order for her to be right for her, where a 3.9 for someone else might be too much and might be hyper. So again, these are nuanced individual patient situations. That's why we seek out, and the best doctors usually are functional medicine practitioners, MDs, integrative physicians, anti-aging docs. They know a little bit more and they go above and beyond, and they're looking at the whole picture like you are, versus just an isolated, oh, you're bleeding, let's put you on the pill kind of incident. Classic Western medicine. While we need Western medicine, it's saved my life. It also is the 3rd leading cause of death in the United States. So just wanted to throw that out there.
Yeah, double-edged sword, I guess, with Western medicine. That's for sure. Yeah, and
That's right.
I tell my patients that. I think I even said it on the podcast the last time I was on. And we live in one of the best countries in the world. If you have a heart attack or you have something acute happen to you where you need immediate medical attention, but man, if you have a chronic disease or disorder, whether that's thyroid or diabetes or knee arthritis, I mean, I don't know what it is. We just can't wrap our minds around looking at the patient now rather than, what drug equals what result or something like that. It's you scratch your head for sure.
Yeah. I just, if anyone listening doesn't realize this, type 2 diabetes, the one you accidentally get yourself into, that or intentionally, but that one is completely fixable most of the time without medication. That's a dietary thing. And so if you go to a doctor and you've got a high HbA1c or you're headed towards diabetes and they say, here's a pill, come back in a year, run to Corey and run to anyone in the functional medicine field, because they'll just tell you what diet to do to get rid of it. You don't need to get on this game of injecting insulin at some point. That is a fucking nightmare. It's asking for trouble, and it's reversible. But people are usually clueless and don't understand, and they're worried, and they go to the doc, and your regular doc down the street's not going to understand keto diet or any other type of low carb paradigm. They're not even going to suggest it. So this is why we look at natural solutions first, and there are so many of them, and then you escalate to classic medicine ones when you have to.
Yeah, absolutely. And I think if you look at our clinic now, that's what we're attempting to do with our direct primary care. We have a wonderful nurse practitioner in our clinic that and I don't know if you know much about direct primary care, but just a simple, small monthly charge so that you have 24 hours a day, 7 days a week access to a primary care practitioner who can help you if you do need, some sort of pharmaceutical intervention. But the goal for us was to, open the door to functional medicine for those people that, may not know about it or may not understand that that's an option for them. So it's been really nice to have some of these people come in seeking primary care for type 2 diabetes and pharmaceutical intervention for it. And then our nurse practitioner who loves functional medicine, and she'll say, okay, well, hey, we're gonna watch this. We're gonna manage this right now with what you currently have. But what's going to happen now is we're going to work on all the things that we know can reverse this disease. And then the ultimate goal is to get you off this stuff.
That's right. So you can, but everybody, you can wean yourself off that with the right people. Obviously, don't try to do it yourself, but it is absolutely possible.
Yeah, absolutely. And the funny thing is we have to say reverse, don't we? We can't say cure.
Cure, right.
We've got to say reverse, but it is absolutely possible. That's for sure.
Absolutely. Thank you so much for joining us. Again, we'll put it in the show notes, but give us your website.
Sure. So if you are interested in the functional medicine piece of what we do, we are at FHCCarolinas.com. That's Functional Health Center of the Carolinas. And then if you are interested in the regenerative medicine piece, regenerative medicine portion, if you have knee pain, back pain, shoulder pain, interested in stem cell therapy, that's QC Kinetix.com. And from there, you'll be able to find a clinic that is close to you.
Thank you so much. Look forward to continuing to watch everything that you're doing over time. And I really appreciate anything you'd like to leave with our audience.
I think we've said it all. I always enjoy getting on here, Elle. Thanks for having me. I think the last thing that we mentioned is something that I just want to reiterate that, most of these chronic issues that everybody is dealing with, or maybe your family member or your friend that's dealing with, a lot of them are reversible. And a lot of them, it doesn't take much to reverse and get you to feel better, whether it's hormones or thyroid or diabetes or joint pain. Always look for the other option, the safer option, the natural option. My mission, and it's been like that for the last decade, is to help people make a decision they otherwise couldn't make themselves for their health. And I will continue to guide patients to do that as long as I have the platform. And, if you're interested in me helping you do that, feel free to reach out.
Thank you so much. And for everyone else, we'll see you next week. Hey listeners, over the years, a ton of companies have approached me to collaborate, but I will only promote companies whose products I believe in and that I actually use and consume on a regular basis. So let me tell you about some of my favorite companies that I can offer you discounts for. Rep Provisions, an amazing company doing incredible things for our planet, topsoil, and animals with regenerative agriculture, and it's my number one source for quality pasture-raised meat and chicken. Visit repprovisions.com and use code L15 for 15% off. I'm also obsessed with a company called Carnivore Crisps. They make a lean, all-natural, and delicious alternative to conventional snacking, made with just real meat and real salt. Totally addictive, and my favorite ones are the beef brisket and the ribeye. Visit carnivorecrisps.com and use code PALEO10 for 10% off. I also love and regularly use Paleo Valley products. They make amazing supplements and delicious paleo products. I use the superfood greens powder, grass-fed beef sticks, the organ complex, and their bone broth bars. I love the lemon and apple. I also use their essential C complex and more. Visit paleovalley.com/promos/Elle Russ for 15% off. I also love Primal Kitchen. They make delicious paleo-approved, gluten-free, grain-free, soy-free, and no refined sugar products, and I use them daily, from their collagen powders and sauces and marinades to their avocado and olive oil. So good, so healthy. Visit primalkitchen.com and use code L10 for 10% off. I also love paleo powder and use it almost on everything I cook. They make incredible seasoning blends, and they also have these incredible grain-free coatings that feel just like crispy breadings that you would have had prior to knowing that there's another way. So visit paleopowder.com and use code L15 for 15% off.